My name is Huang. I'm the program director for the University of Washington Hand Fellowship.
I'm Nick Vedder. I'm the Chief of Plastic Surgery at the University of Washington and a member of our combined hand surgery service.
My general approach for fellowship training, especially in the operating room, is really graduate autonomy. At the beginning of the rotation, at the beginning of the fellowship year, we really try and gauge what they're comfortable with, where their knowledge base is, and their surgical skills. Based on their comfort level and really their confidence, try and really let go gradually. The goal is over time at the end of the rotation, my goal is to really just sit on the sidelines and watch them and really guide them as necessary.
It's always a graduated experience, but one of the key things that you need to learn as an educator is picking up on what a trainee's capabilities are. And you learn that in the first week or two, and at that point you start giving them more and more independence. I'm never the operator myself. It's always the fellow and the resident.
I think what makes the University of Washington Hand Fellowship special is really, it's both the place and the people. I think because of our unique geography, we really cover that whammy region. We talk about Washington, Wyoming, Alaska, Montana, Idaho, so we really get the most complex pathology concentrated, flown into as a tertiary referral center and also a level 1 trauma center. And also the people. I'm very fortunate to have 8 colleagues across hand surgery and a combined fellowship, meaning that's orthopedics and plastic surgery combined. So you really get the best of both worlds, soft tissue, bony fixation, and really get principles combined into one. And really a team concept. We really believe we all work together to ultimately for patient care and fellowship training. So I think we really have the best of both worlds as far as collegiality, the training grounds, and how well we work together as a team.
What's neat here is, and I think that what's really unique about our program is that it is a truly seamlessly combined program between plastic surgery and orthopedic surgery. One of the biggest benefits, advantages of this hand fellowship that is truly unique is that we are the only hand fellowship for a 5-state region, a population base of 11 million people. We have the only level 1 trauma center for that whole area. And again, we're the only hand fellowship in that whole area. So you see an incredible volume and breadth, diversity of hand problems. And some of our areas of strength tend to be weaknesses in other programs. We have a very strong trauma experience. We have a very strong pediatric experience. If you come from an orthopedic background, you're going to get a very good soft tissue experience. And obviously, if you come from a plastic surgery background, you're going to get a very strong skeletal experience. And so I think those two things work very well to make this marriage between plastic surgery and orthopedics something that makes an incredibly rich experience for a hand fellow coming in here, no matter what their background is.
I think with COVID, it's been very different, but I think as you talk to the fellows, the alumni throughout that's come through the fellowship, this is now the 30th year of the UW Hand Fellowship. I think they'll tell you that it's not, I think all the faculty who are here are really committed to education and also mentorship. They're also very approachable. Like even if you look at Dr. Vedder, Dr. Hannah, who are obviously world-renowned and considered really experts and gurus in their field, they're also very approachable. They want you to succeed. They want you to learn. So when we have the journal clubs, it's at faculty houses. We discuss some of the more modern articles that might have an impact on your future clinical practice and careers. But it's also really just a social setting. We kind of get together, grab a couple beers, and typically the faculty host the dinner. And it's meant to be a very informal setting. But throughout the year, the faculty are all very approachable. You could really email or call any of them on the phone. I think Dr. Hannah also has a standing offer. Once you graduate from fellowship, you can always fly back to Seattle, maybe go fly fishing with him and kind of get together with him on the weekend. He'll help you prepare for the board. So I think we're all very approachable. I think it's always great to always get that phone call from fellows who are 4 or 5 years out from their fellowship and still kind of call, just kind of say hi and let us know how they're doing and just kind of touch base again.
We have a great alumni network that reaches across the country and across the globe, actually. So we have some of our alumni regularly come back to the Hand Society meeting from Israel, from Iceland, from truly around the world. And it's a very close network. And so every year at the Hand Society we get together for a dinner, and that's where the alumni fellows get together and meet each other, meet the new members, and a lot of those relationships continue forward.
I mean, I think, people talk about trauma is trauma. You have trauma everywhere. So we're a level 1 trauma center, similar to a lot of large academic centers and large county hospitals in the country. But you kind of hear there's trauma, there's Harborview trauma. I mean, certainly I'm biased, I'm here. But I think because there's so many different regions surrounding us, the traumas that come to us are the ones that nobody else feels comfortable with. So we have patients flown in from Alaska with shark bites. We have horrible industrial injuries from Eastern Washington, from Montana that come in. Even though there are several hospitals, very well-trained hand surgeons from those regions, and just the complexity, and also that multidisciplinary approach for us, it's orthopedics and plastic surgery will work well together. So it could be the most complex bony injury with soft tissue defect, with nerve defects, because we work so well together. I think we really feel confident that we can provide the best care for that patient regardless of how complex and what the injury involvement is. I think we really provide the best care. And I think certainly with tertiary referrals, I think Dr. Handel's been here for a long time. I think if you look at his practice, it's essentially 50% revision, whether it's a complex disarrhythmia that's been revised multiple times, or somebody with a complex elbow problems had 2, 3, 4 surgeries. This really becomes the last stop for them. I see a lot of these patients that Dr. Handel and Dr. Vedder and some of my senior partners do as well, is we're really seeing as a safety net. And I think we have a general approach is, how can we help you? So I think a lot of the private practice guys feel very comfortable reaching out to us, say, hey, I have this patient, I've tried my best, I've done everything possible, I don't know what else to do. And then we kind of just welcome those patients and also the referrals with open arms. I think because of that and kind of our unique geography, we really do get very, very complex patients. We certainly do. I think if you look at, we talk about the residents and fellows, they kind of step on each other's toes. On my Thursday ORs, I'm running 2 rooms. On average, we're probably doing about 12, 13 cases. So in general, the fellows are getting that really complex case. It's a revision dysarrhythmia. It's a wrist reconstruction for multiple surgeries and injuries. And the residents doing the carpal tunnels, the triggers, and your metacarpal fractures, simple dysarrhythmias. But certainly if the fellow feels that they want that bread and butter hand surgery experience, it's there for them. So I think if you look at my average OR day, it's really kind of a mixture of complex and bread and butter. So we are doing carpal tunnels and trigger finger releases and thumb CMC surgery, but you're mixing that with really complex surgery. I think you're not missing out on the bread and butter, but I think our average fellow is not going to do 200 carpal tunnels, but they're probably going to do about 20 or 30, enough that they're very comfortable. But I think what sets us apart from other fellowships, if you look at our overall case volume, the average fellow is doing a lot more CPT codes here compared to other fellowships. But on top of that, if you really kind of dive deep and look at the case distribution, they're doing a lot less carpal tunnels than some other fellowship programs. They're doing a lot less trigger fingers, but they're doing much more nerve reconstructions and flap coverage and complex wrist reconstructions compared to other programs.
And I like to say I learn as much from the fellows as they do from me, and that's one of the most enjoyable things about having trainees, especially advanced trainees like hand fellows.
My advice to people, whether it's a resident or a fellow looking at different programs, is really identify your mentors. When you go to a fellowship interview and you're talking with the attendees, there are a lot of great programs out there. There are a lot of programs that are very busy with great cases, great pathology, but who do you feel like you can really relate to? And I think, who are your future mentors, not just during your fellowship year, but for life? And I think here we're unique. We have 8 hand faculty who are all just phenomenal surgeons, but just phenomenal people. I think it's a really special place. I think it's really hard to find a place where all 8 faculty get along really well. And we all really have one common goal, is to train the best hand surgeon in the country. And regardless of your background, where you start as far as orthopedic or plastic surgery, how experienced you are, where you stand, our goal is we're going to be there for you, not just in the fellowship year, but throughout your careers, to really be the best surgeon possible.
I would say what you want in a fellowship is something that at the end of the year you will come out both with the competence and confidence to handle anything that gets put in front of you. And in hand surgery, orthopedic surgery, plastic surgery, you come through training and you think, I'm ready to deal with anything, and then you get something that you've never seen before. But you've had the experience of seeing something like that, knowing the principles, having had the experience of dealing with a challenging problem like that, and you're able to take those principles and put it together into a plan where you have the confidence to execute your plan and deal with this problem and address it and treat the patient in an amazing manner. And so I think that's what you want in a fellowship, and this is really what this fellowship provides. It provides you with that broad experience that is very deep, so very, you're seeing some very complex problems. You're learning the basic principles, and you come away having dealt with some very difficult problems, and through that you have the confidence to handle whatever comes in front of you. And that's the most important thing I think you get out of this fellowship that is really quite unique to this fellowship.
So, certainly as the program director, really excited in your interest in UW Hand Fellowship. We know there are a lot of great hand fellowships out there, phenomenal faculty and mentors from across the country. I certainly feel very privileged to be part of this really special group. We're in a very special place with special people who really have your best interest in heart. And I think you'll find that we really provide all the resources possible, the surgical volume, the surgical complexity, resources and research, cadaver lab, clinical cases, and we have a really robust curriculum as far as education. And I think you'll find that hopefully we offer all the tools that you'll need to become a really successful hand surgeon when you graduate from our fellowship. So really appreciate your time and interest, and we really look forward to meeting you.